A local pediatrician says he has seen a spike in strep throat cases and other illness in kids.
Well, Leah Bolin spoke with him about why this could be and how to best protect yourself.
I spoke with Dr. Alan Coffman. He told me there could be multiple reasons why there's been an uptick in strep throat cases.
There was a big bump right as school started. It calmed down for a little bit, and then this last 2 weeks, it's back up again.
He says one reason could be that people aren't properly taking care of their hygiene.
Everyone was so careful and so vigilant during the pandemic that there's a bit of a hygiene honeymoon. I see people who are less careful with just general hygiene.
He also says that recent studies show how COVID-19 affects your immune system.
There's some specific changes that happen that make you less able to fight viruses and strep bacteria specifically. It's 6 weeks to about 8 months that you'll see some suppression in your immune system.
And because of this, he thinks a lot of kids came into the school year without being able to clear their illness.
I think a lot of kids couldn't clear it. That makes it harder, makes it easier to spread because you've just got it in the community more and it's lasting longer and there's more exposures. So it just makes fighting it a lot more difficult.
He says leaving strep untreated could lead to more serious complications.
So you can get rheumatic fever, you can get kidney damage, you can get heart damage. And so that's why you want to be aggressive with strep. It also is no fun to have. And so treating it makes it clear faster and also limits its spread to other people.
He says strep can look like anything, but there are some classic symptoms to look out for.
The classic symptoms are going to be bad headache. You feel bad. Most people run fever. Usually you have a very bad sore throat. Adults, it'll be the worst sore throat you've had in a long time. And you also tend to have GI symptoms. Most people will have a little bit of nausea or vomiting.
He says people need to be without fever and on antibiotics for at least 12 hours before interacting with others. And to stop this from continuing, people need to return to good hygiene habits.
We need to get back into the habit of coughing into our arms and making sure we use Kleenexes when we blow our nose and wash our hands real well before we eat.
Reporting in Studio B, I'm Leah Bolin, Local 3 News.
Dr. Coffman says he's also seen an uptick in anxiety, especially when it comes to illness, causing people to become even more susceptible to viral infections and strep.
And he urges people to give themselves grace and, yes, take care of yourself.
Yeah.